New Mexico's healthcare landscape is a complicated one. While a small state population-wise, we are spread out over a large area, and we struggle with having enough providers, especially in rural communities. It's important for the overall health of our state to grow our own doctors and other medical personnel, and a health apprenticeship program at the Casa de Salud in Albuquerque South Valley gives teens and young people the chance to gain valuable experience in the healthcare industry. The program also offsets some of the costs of the clinic, which provides an integrated approach to medicine that is affordable for a mostly immigrant clientele. This week, special correspondent Sarah Gustavus learns more about how the program is reshaping healthcare in our state. But up first, we meet some of the apprentices themselves.
All the apprentices here come with big dreams, and they want to be in the medical field, helping whatever they have on their dreams, doctors, physician assistants, nurse practitioners.
This is not a typical clinic. They see you as a whole person and not just a symptom. We have a lot of patient interaction from the moment that they walk in, from the moment they leave.
If they need just a basic medical visit or it's a little more complicated, here in Casa de Salud we have other modalities. Not only the Western doctor, we have acupuncture, we have somebody who helps with limpias, acuditox, several modalities that it doesn't not only covers the physical aspect or the disease itself, but as well the emotional, mental, spiritually for somebody that sometimes in a big hospital or big entities, we don't see that.
Apprenticeship is typically a year, and then once you become a senior apprentice, then it's another year. I became a senior apprentice just recently in August, and so now I'm going to be my second year here.
We have several apprentices right now, around 18 of them, that they're all since high school students, all the way to college going to the medical field. We have apprentices going for nursing, for physician assistants, for nurse practitioners, for doctors. One is interested in pharmacy. So I help them with the clinical skills as well as helping patients throughout their visits on the clinic.
Yeah, I'm getting so much experience, so much hands-on that I wouldn't be getting anywhere else.
I learned how to draw blood here. I help to kind of get the glucose, urinalysis, and also help with the procedures and also perform, for example, the electrocardiograms that some patient needed, an eye acuity exam, ear lavage.
There was a lot of doors that weren't open for me specifically, and here at Casa, they don't have any of those requirements. They don't look at any of that. They're just here for someone who wants to learn and wants to have hands-on experiences. So having an apprenticeship like this, it gives them exposure to that, something that they could have never had before.
I'll get them. Our majority of the patients, they're immigrants. The immigrants modeling was only Spanish speaker with no insurance. We also help with the exchange program through the Department of Health. So we help the population that they might have an addiction with intravenous drug use. So we can help them to exchange syringes to avoid transmission of other, for example, HIV, hepatitis C, and also to avoid infections. We don't decline service to anybody.
Casa de Salud, how may I help you? Like, there's always going to be jobs for nurses, there's always going to be jobs for doctors, especially in New Mexico, since New Mexico is super scarce on doctors. And a lot of people study here in New Mexico and then they leave New Mexico. I want to be able to study here and stay here and serve the community that I grew up in. I don't think I'd be where I am if it wasn't for Casa.